start the session. I'll be showing a picture probably, ask a few questions about that, and whoever raises the hand first gets the chance to answer. And this is limited to, or the people who could answer are postgraduates, interns, and medicals if there are any, not for the faculty. Right. And I expect the faculty not to help them. No. It's not going that much. So, shall we start? Say yes, dear. Yeah, that's great. You are seeing a case where the diagnosis is obvious. It's to be literally, it's written on the face. So what's the diagnosis? Everybody can answer it about us. What's the diagnosis? Capillary hemangioma. Involves the entire half of the face. And what's the complication that can occur? After I just discount. Right, go. And more than actually now the question is, what's the best way to treat that? This condition. Raise your hand. Who is going to answer? Raise your hands. Not a single person. Yeah.
Steroids and beta
Steroids and?
blockers.
Which do you prefer and how do you give it? What do you give it? Are you going to be giving intralesional injection or oral steroids?
Steroids and oral beta blockers.
And now I want one answer. How do you postgraduate, sir?
Intralesional.
Pardon?
Intralesional.
Intralesional you want to give. Anybody else?
Blocking the feeding vessel.
Blocking the feeding vessel. Great. Anybody else? Loud and clear. Get up. Systemic corticosteroids, what's the dose? Remember, if you want to get a prize, you should be very precise in your answer, right? What's the dose?
1 to 2 milligrams. Oral steroid 1 to 2 milligrams per kg body weight.
Your chances are sir. It will have come back to you. Actually, my dear, come on. Right. Once upon a time, we used to give intralesional transfer at a dose of about 20 milligrams under general anesthesia, both intralesional and perilesional. But the disadvantage with that is that it could lead to the most important complication is if there is a complication, it can cause a central knot obstruction and make the child blind. The other things could be there could be hirsutism, there could be ulceration. Now, we have changed over to medical management with propranolol at a dose of 1 milligram per kg body weight in 2 divided doses for about 3 to 4 months or 5 months under the care of a pediatrician. And that's what we have done. And the child, over a period of 1 year, has improved like this. But as somebody has rightly pointed out, because the eye has been covered with the mechanical doses due to the tumor, the patient developed amblyopia and also the patient developed convergent screen. Whenever there is something which interferes with the vision, children develop a convergent screen because they have a very high amplitude of accommodation. And when you are not able to see, you try to accommodate and that leads to the convergent screen. So we have to do surgery and to prescribe glasses, hypermetropic glasses, and the child is doing well. He's now about 1.5 years to less than 2 years, and we are still not able to check the visual acuity. But apparently the patients are quite happy. So this is about the capillary hemangioma management. Okay? Let's move to the second one. What's the diagnosis? It's a very simple undergraduate question. And I don't want my PGs to answer this. My PGs has number later. This patient, this girl has a severe bilateral doses. Agreed. What else she has is that If you look at the distance between the medial canthite, both sides, it is very much. There is a case of a blepharophimosis syndrome in which we require, again, nearly 40% of these people do have amblyopia. So for these people, what we have to do is we have to do surgery in 3 stages. Correct the telecanthus, improve the horizontal line and widen it. But since there will be some abnormality with the bone also, the results are not absolutely normal, but we can improve them better. This is the case of blepharophimosis syndrome, and the gentleman gets the prize for saying bilateral doses. May I know your name, sir? Right. Saraf and corner diet. And these are. And my dear Watson, what's his qualification? Yeah. Loud and clear here.
He's a physician working
Is a physician working with the military. The person has been leaked. No? Okay. Anybody else? Do you go it further? Why the hell am I interested in general doctor? Doctor Josh is So, Conradile has studied his ophthalmology, striking ophthalmology in Vienna, moved to London, upper Wimpole Street, London. And a Westminster Council brake is in place over the front door even today, where he has practice. That's about Sarata Conradile. What is this? Anybody? Style. Why is style? Okay. What I want you to draw your attention is, this is the place which has been involved, as you can see. But the most important feature here is, you can see the eyelashes here, but not at the place where the lesion is there. Loss of eyelashes is the characteristic feature cell carcinoma, a squamous cell carcinoma, or a basal cell carcinoma. Any of them, if it comes to the margin, as it invades, the follicles get destroyed and there is a loss of eyelashes. So any lesion which may look even like a chalazion, if there are no eyelashes there, it is most probably 95% of times it's a deep cell carcinoma. Similarly, a blepharitis that doesn't heal, as you can see in this patient. A blepharitis that's not healing is loss of. So ulceration, loss of cilia, nodular growth or elevated margins, non-healing blepharitis, and rounding of the posterior margin of the eyelid. Usually the posterior margin of the eyelid is very sharp and is in contact with the globe, so that the tears drain by capillarity towards the nasal. It gets rounded. All these are symptoms or signs suggestive of malignancy. Who discovered methotrexate? Great. Actually, this is what I can't do. Right. Is born in Himu around West Godavari district. It's a Telugu. It's found a being of the synthesis of folic acid and has a role in the development of tetracyclines also. So he has so much contributed, but it's unfortunate that he has not got a Nobel Prize. He deserves probably 2 or 3. Probably being in India, he did get it at the time. So I salute you, sir, posthumously. Pardon? Parkinsonism. Return me the gift that you had. But I can see those symptoms in a few of you.
Good.
So you want it? So I think that concludes the session. I thank everybody who has participated.
Yeah, now activity to present paper of study and relationship written work, having and occupation of stress in police person.
Persons, all the professors here and my dear friends. My paper presentation is on the study of relationship between work-family conflict and occupational stress in police personnel. Introduction. Both work and family are central to one's life, but these roles do not always readily reconcile. In particular, when workers are faced with major stresses in the workplace and long working hours, such as in police service. Balancing work and family has become an increasing challenge for police personnel. According to Letimer et al., what is work-to-family conflict? It refers to a form of internal conflict in which the general demands of time devoted to and strain created by the job interfere with performing family-related responsibilities. And what is family-to-work conflict? It is the strain created by the family that interferes with performing work-related responsibilities. So what is stress? Stress is a psychological factor that is harmful to physical and psychological health and dangerous to quality life concept. The present study has focused only on organizational and operational stress. So organizational stress is produced within the department, odd and long working hours, the holidays being worked, and the strict discipline that is imposed on officers. So what is operational stress? It can be described as a stress that happens in the place of work. Often a police officer can become stressed from offensive policies and procedures, too much of paperwork and poor training. There are very few Indian studies on relationship between work-family conflict and occupational stress in police personnel, hence the study. So what are my aims and objectives? Are assessment of work-family conflict, assessment of operational and organizational stress, and assessment of the relationship between work-family conflict and occupational stress. Coming to the materials and methods, the study design is a cross-sectional study which is conducted for a span of 3 months from June 2014 to August 2014 in the region of Visakhapatnam. 141 police personnel of the rank of constables and sub-inspectors in Visakhapatnam region with the study group. My inclusion criteria are the police personnel in the age group of 18 to 50 years and who give a consent to be a part of the study, and exclusion criteria are police personnel above 50 years of age and who are having severe medical disorders. The statistical analysis was done using SPSS version 20. We used descriptive statistical analysis, student t-test, and Pearson's test of linear correlation. The study was approved by the Ethics Committee of Vijayanagram, and tools used in the assessment are a semi-structured questionnaire on socio-demographic data, and the police stress questionnaire, which was developed by McCreary and Thompson in the year 2006, was used. The operational and organizational police stress questionnaire, consisting of 40 items, 20 job content and 20 job context questions, which is measured on a 7-point Likert scale system, and we used Letimer Bowles and McMurray work conflict and family conflict scale developed in 1996, and it has 5 items, and it is also measured on a 7-point Likert scale system. And the score ranges from 5 to 35. A high score indicates a high level of conflict, and a low score indicates a low level of conflict. Coming to the result, a total of 141 police personnel participated in the study. Of this, 107 were constables and 34 were sub-inspectors, and police officers reported moderate levels of stress in both organizational and operational aspects. Participants experienced work-to-family conflict more than family-to-work conflict. So this graph depicts the same. Coming to the constables, there was a very significant difference between male and female constables on organizational stress aspect, that is 0.038, and in constables there was a very significant correlation between all the 3 variables, except that there is no significant correlation between organizational stress and family work conflict. And in male constables there is a significant correlation between all the 3 variables except organizational stress and family work conflict. Coming to female constables, interestingly, there was a significant correlation only between 2 variables, but there wasn't a significant correlation between organizational stress and family work conflict and operational stress and work-family conflict. In sub-inspectors also, there is a significant difference between male and female sub-inspectors on organizational stress, that is 0.011. And there is a significant correlation established between all the 4 variables in the case of sub-inspectors. Coming to the discussion, it was expected that officers would report organizational stress more than operational stress. stress. But what the study concluded that the occupational stress measures did not yield any significant results because police officers reported a moderate levels of stress on both organizational and operational parameters. These moderate reports of stress were similar to results of a previous study done on 47 Ontario police personnel. And in a similar study done by McCreary and Thompson, they were able to determine that organizational stress was reported more than operational stress. Participants experienced work-to-family conflict more than family-to-work conflict, and these results are similar to a study done by Sandy Zubizana and Nicole Dodd in 101 South African police personnel. Our study established there is a significant correlation between occupational stress and work-family conflict, both in constables and sub-inspectors, which was similar to the study done by Neepal Barrett. And as the study was carried in a small sample, it needs to be representative of all the population. And the study established moderate levels of stress in both operational and organizational aspects. And being a psychiatrist, what we can do is that a semi-structured interview for assessing stress, coping methods, motivation and personal support system together with personality profiling and the capacity to maintain emotional distance from cases are all key components that must be made as a part of recruitment test in police. And it's also useful to assess all the above key components at multiple points. And workshops can be conducted to undergo stress management and to teach positive coping techniques like progressive muscle relaxation techniques, yoga and meditation as to reduce the mental stress in police and the impact of it on the family life, and advising them to maintain good personal, physical health and mental health. Thank you.
I had during the recent annual national conference of